Well, the face plan is a novel idea that we came up with because so many patients have questions about what to do as far as the aging face. Many patients will, in their 20s, need things that they would never consider in their 30s or 40s based on their aging. And people in their 40s and 50s and 60s and beyond will many times not achieve their goals and expectations with procedures that would have worked in their 20s. So there's some confusion in the public and even among surgeons about what to do when there's so many options available. And so, you know, if all you have is a hammer, the world kind of looks like a nail. Well, hopefully, as plastic surgeons, we have many tools in our armamentarium, and so we can choose from those tools to do what's appropriate at different ages. So the face plan came about because you can pretty much look at someone and determine where they're going with their aging with experience that many plastic surgeons have based on their genetics and their environmental factors such as sun damage and things like that. So it's more predictable than it seems, and to the patient who's constantly confused with all the information in the magazines and the lay press, it can be very difficult to know what to do, and so they rely on their plastic surgeon to tell them. We've come up with an idea that's a little bit more clear about what may be done in certain age groups and what options out of all the many options are available that will achieve their goals. So for instance, if you take a patient such as this, even though he's in his 20s, in his late 20s, all the fillers and Botox in the world won't accomplish his goal of going from this look to this look. It requires surgery. And so even though most people would expect that, some people and patients think, well, I can accomplish this without having to go through surgery. Because these days it's anything but surgery, because no one wants to have surgery if they don't need it. But if your goals and expectations are X and you can't achieve them any other way, it's good to at least know that up front. And if you know that 20 years from now or 15 years from now that your genetics and your aging are going to need to have a certain procedure or treatment to achieve what you want, it's nice to kind of know what you're looking at. So that's why we came up with the face plan. You know, you wouldn't really build a house without a floor plan, and you wouldn't go to the Super Bowl without a game plan, and so why age without a face plan? And so that's what we came up with, and we feel like it's a real addition to someone to give them an idea of where they may be going down the line.